I chose geriatrics because I love the patient population. I was introduced to a geriatrician back home in India when I was working in a private hospital, and I loved working with his patients, and I realized that that's what I was meant to do. Through residency, I had a mentor who was a geriatrician as well, so it was kind of an easy pathway to it. The other reason is that it's a very complex clinical management, and also it's not a sexy field to be in, so that's why I chose geriatrics. Brown was my first choice for geriatrics because my mentor trained here, and I was lucky to rotate with his team during my elective in residency. The best asset of this program is its co-management program. It's unique in the country. The diversity among the staff is a bonus. I've always felt welcome here since day one, and this has become like second home in the last 1 year. At the end of the year, though, I've become very comfortable in terms of being able to prescribe opioids, antidepressants, antipsychotics, and also being able to manage the complex medical care of residents in nursing homes, which was intimidating to begin with, but now I can do it at ease. We were lucky to have been the first batch that had weekly research meetings, and hence we were able to all get a paper published and a poster published. Looking back now, I think I have a different perspective about the role of a data analyst, about the role of a clinician in the analysis of raw data, and working as a team was probably the best way to do it, and I'm looking forward to using the same techniques in the future.
After residency, I was working as a primary care physician. I was very empathetic towards older adults, and even some of my patients thought I'm a geriatrician, and some insurance companies started referring patients to me as a geriatrician. I'm empathetic towards the vulnerable patient population, so this came naturally with the geriatrics patient population. After treating older adults and knowing how complicated their care is, I wanted to formally study geriatrics so I can give better care to my patients. The fellowship met my expectations and far exceeded my expectations, so I was able to practice geriatrics medicine in the hospital, the nursing home, the clinic, and in different settings. This gave me a lot of experience that makes me feel confident that I can manage the care of older adults better. What I like the most is mentorship in research. From the start of the fellowship, I was able to get involved with Dr. Gravenstein on a big project with data from the VA. All the fellows got involved. We had very good one-on-one mentorship. We were able to publish posters and are currently working on manuscripts. Every single fellow was able to publish during the fellowship. The mentorship was excellent, and I think it's necessary for us to transition to a more academic career. I'm interested in continued involvement in academia and research. I very much like clinical work, but I'm going to start taking part of my time and putting it in academia and research. I love Rhode Island. Most people around the country don't know how amazing this place is. Rhode Island is a smaller state, but it has everything. You have nature, hiking places, oceans. You have the downtown of Providence. You do have the city feel without it being a very crowded or expensive city. So it's a moderately priced city. It's not, you don't struggle with traffic jams like some of the other biggest cities, but still you do have the city feel. So I feel Rhode Island is an amazing place. I've been here for 13 years and I really love Rhode Island. I would start by saying that there's 4 fellows, and the 4 fellows published a poster and are submitting a manuscript. I think this is rare that you have 100% of your fellows publishing, presenting a poster, and working on a manuscript in a single year. So this program has excellent mentorship in research and academia, and I would bet that this is very rare in any place in the world.
I got interested in geriatrics when I was practicing internal medicine, and I recognized that there was an opportunity to do better for the patients I had with geriatric syndromes. And I knew enough to know that we needed to be doing better, and that helped me recognize the value of doing training in geriatrics. My experience at Brown has been wonderful. I've had wonderful clinical experiences in a variety of settings, including nursing home, ambulatory, and in the hospital. We do surgical co-management here. And we've also had a mentored research experience where, as part of a team, including analysts, mentors, and fellows, we developed a research project and brought it from the early stages to abstract presentation at a national conference, and are carrying that forward into manuscripts which we feel are good enough to submit to national journals. The best preparation has been to work with a variety of attendings and mentors who have excelled in different specialties and disciplines. So as part of this program, we get to work with attendings in geriatric psychiatry, palliative care and hospice, and geriatricians who are innovating in different aspects of healthcare delivery or research. And so through that broad exposure to different mentors and teachers has helped me to develop toward the goals that I'd like to achieve.